Okay, folks, I've got discussion B for you. Hold on a second until I get ready for the show, and I'll be right with you. Give me 1 second, please. Make sure these are even. Okay, guys, we're going to discuss uh, brain health this afternoon for B. Okay, making dietary changes. That making this phrase emphasizes that making dietary changes or dietary improvements at any age in life can positively impact brain health. The surrounding page content discusses a study showing that adults who maintain healthy eating habits and reduce abdominal fat in midlife tend to have better brain health by age 70. Research highlights that uh, waist to hip ratio is a more accurate measurement of belly fat than body mass index or BMI, and that reducing central obesity can lower risk of dementia. The article also explains that obesity affects brain function. Okay, so we're going to discuss that for today's B. Influencing memory and cognitive executive skills. However, lifestyle changes such as adopting a balanced diet rich in plant-based foods and maintaining weight can still make a difference in cognitive health. Um, Even in middle age. Additionally, exercise plays a crucial role in reducing belly fat and supporting brain function. The findings reinforce the importance of proactive health choices before significant cognitive decline occurs. Okay. The study examined the relationship between diet and brain health by analyzing long-term health data from adults in middle and midlife. Researchers focus on waist to hip ratio as a key measure of abdominal fat rather than body mass index to assess its impact on cognitive function. Participants' dietary habits were tracked over several years, and their brain health was evaluated at age 70. Okay, folks. The methodology involved comparing individuals who maintained a healthy diet, rich in plant-based foods, with those who had higher levels of central obesity. Cognitive assessments measured memory, exclusive function, and dementia risk. The study also considered lifestyle factors such as exercise and overall weight management to determine their influence on brain health. Findings suggest that reducing belly fat and adopting a balanced diet could significantly lower the risk of cognitive decline. Okay. The study used cognitive assessments to evaluate participants' memory, excessive or executive function, and overall brain health. These assessments include standardized tests designed to measure different aspects of cognitive ability, such as recall tests, recall tasks, problem solving exercises, and attention based evaluations. Researchers also considered factors like processing speed and uh, visio visuospatial skills to determine how diet and uh, abdominal fat influence cognitive performance. Additionally, some studies used uh, neuropsychological testing to detect early signs of cognitive decline, including dementia risks. These tests often assess memory, retention, reasoning ability, and executive function, providing insight into brain health over time. If you're interested in more details, I can look up additional sources for you. Cognitive assessments vary in their approach, sensitivity, and purpose. The tests used in this study primarily focused on memory, executive function, and dementia risk, which are common in many cognitive evaluations. However, other assessments, such as the Mini Cog Montreal Cognitive Assessment, or MOCA, and Rowland Universal Dementia Assessment, or RUDS, are designed for broader screening and may emphasize different cognitive domains. For example, the Mini-Cog combines a 3-item recall test with a clock drawing task to quickly assess cognitive function. The MOCA is widely used for detecting mild cognitive impairment and includes tasks covering attention, memory, language, and visual spatial skills. The RUDS is particularly useful for diverse populations as it minimizes the impact of language and cultural differences. Additionally, some studies compare the effectiveness of different cognitive screenings tools. One study found that the memory and executive screening, the MAS is called MES, was more effective in identifying subtle cognitive decline than the mini mental state exam and MoCA, as it had higher sensitivity and specificity. Would you like to explore how these tests are applied in clinical settings? Cognitive assessments vary in effectiveness depending on their purpose, sensitivity, and depending on the population being tested. Here is a comparison of some commonly used assessments for brain function, guys, or brain health. MiniCog, a quick screening tool combining 3 item recall tests with a clock drawing task, is effective for detecting cognitive impairment, but may not provide a detailed evaluation for executive function. Montreal Cognitive Assessment, or MoCA, more comprehensive than MiniCog, covering attention, memory, language, and visuospatial skills. It's widely used for detecting mild cognitive impairment and has strong sensitivity. The Rowland Universal Dementia Assessment Scale, or RUDS, designed to minimize the impact of language and cultural differences, making its use for diverse populations. Memory and executive screening, or MES, found to be more effective in identifying subtle cognitive decline compared to the mini Montreal State exam. Okay, give me a minute, guys. And MoCA, due to its higher sensitivity and specificity, neuropsychological assessments considered the gold standard for cognitive diagnosis. These tests evaluate multiple cognitive domains, including memory, language, attention, and decision making. Each test has strengths and limitations, and the choice depends on the clinical setting and the specific cognitive concerns being assessed. Would you like to explore how these tests are applied in the real world for seniors? For elderly patients, cognitive assessments should be sensitive to age-related changes, while effectively detecting impairment. Here are some commonly used tests. Okay, give me 1 second. Okay, now I'm gonna go down each one. Mini-Cog, a quick screening tool combining 3-item recall task with a clock drawing task. It's simple, fast, and effective for detecting cognitive impairment. Okay, then the next one is Montreal Cognitive Assessment, or MoCA. More comprehensive than Mini-Cog, covering attention, memory, language, and visual spatial skills. It's widely used for detecting mild cognitive impairment. Okay, then there's Rowland Universal Dementia Assessment Scale, or RUDS, designed to minimize the impact of language and cultural differences, making it useful for diverse populations. Okay, then there's General Practitioner Assessment of Cognition, or GP-COG, a brief screening tool that includes both patient and informant assessment, making it useful for primary care settings. Okay. All right. And then there's the AD8 Dementia Screen Interview, a short questionnaire that helps differentiate normal aging from dementia. Each test has strengths and limitations, and the choice depends on the clinical setting and the specific cognitive concern being assessed. Would you like to explore how these tests are applied in the world for seniors? Okay, folks. So that's B for you. I'll be back on shortly with C. Give me a little bit for C, please, and I'll be back on with that as soon as I can. All right. So I will see everybody for C shortly. Give me a bit for C, please.